Did you know that 30% of Americans are affected by nail fungus? Nail fungus, also known as onychomycosis, is where the fungus travels underneath the nail plate and into the nail bed. One typically knows that they have a fungal nail infection when the nails are yellow, discolored, thickened, and the actual nail plate lifts up from the underlying nail bed. At this point, you can usually see debris underneath the nail plate as well. There are many treatments for fungal nail infection. Because of the thickness, the most basic form of treatment is called debridement. This is where the nail is reduced in thickness by an electric grinder, and the nail is also trimmed back very far. Also, there are topical medications. These tend to take a while to work because the medication actually has to travel through the nail plate to the underlying nail bed where the fungus lives. Also, as a form of therapy, there are oral antifungal medications. Oral antifungal medications come with their own adverse risks, such as patients can report feeling lightheaded, rash, dizziness, and stomach upset. Also, if a patient is currently taking a host of medications, the oral antifungal medication can interact with these as well. Therefore, laser treatment has become a very safe, clean, and efficient way to treat a fungal nail infection. The reason why the laser is a safe treatment is because the laser kills fungal cell walls. Our cells do not have cell walls. Therefore, the laser selectively destroys the fungus and leaves our surrounding skin intact. Today, I'm going to be demonstrating how laser therapy is performed. At this point, we would have already debrided the nail. We would have reduced the nail thickness with an electric nail grinder, and we would have trimmed the nails very far back so that the laser beam can penetrate. It is very important that the person administering the laser and the patient wear protective eyewear. So let's get started. One of the most important points in administering the laser treatment is the laser beam has to be perpendicular to the nail plate in order to effectively kill the fungal cell wall. And let's begin. I like to start at the inside corner of the nail and back to the proximal cuticle. It is also very important that you do not allow the laser beam to stay in one portion of the nail for an extended period of time. You want to evenly move the laser beam over the nail and make sure that it is perpendicular. Because our nails do have a curvature, we do have to constantly move the laser beam. Again, staying perpendicular. And the rest of the nail plates would be treated in the exact same manner as well. Typically, within a couple months, you will notice that the new, clear, healthy nail begins to form and the old fungal nail begins to grow out. Also, what can be done is you can administer a topical antifungal to further ensure that the fungus is eradicated. Your physician will want to follow up with you in 1 month. At this point, you can also do another treatment of the laser. And within about 9 months, you will notice a clear, healthy new nail.